here. My name is Krista. I'm an international mom of two, a dental hygienist turned midwifery student, and here on my channel I talk about all things motherhood, midwifery, pregnancy, and childbirth education. So if these things are of interest to you, please follow along and get ready to birth and bloom. Hello, hello. Welcome back to my channel. I'm so happy you're here. So today I wanted to touch on what life is like in that first 24 hours after your baby is born. I think this is a period of time that just gets forgotten because during pregnancy you're doing everything you can to learn about having a healthy pregnancy and then labor preparation and birth. And unfortunately, I think the immediate postpartum and the postpartum period in general is something that is overlooked. And I think it takes many first-time moms by surprise that it is more of an intense experience than they were initially prepared for. So in this video, I kind of want to bundle it up for you in about the 24-ish hour mark of what you can expect in that first day of life after your baby is born. I think it is something that no one can prepare you for. Doesn't matter if it's your first baby or your fifth baby, the postpartum period can look different each time for everybody. But especially for first-time moms, I think this is a period that you need to just learn a little bit about what to expect, what's going to happen to you, what's going to happen to baby after birth, and just to give you a better idea of what's going on, how you can best prepare. And once again, nothing I say or nothing your sister says or your friend says is going to really prepare you for your personal experience, but I do find it helpful that you at least have a little bit of an understanding of what is to come. Okay, so let's do what I usually do. I'm going to refer back to my two birth experiences. My first birth was in the hospital setting, a normal medicalized birth, and my second birth experience was in an out-of-hospital setting at a freestanding birth center, and I had an unmedicated water birth there. So I will kind of use both experiences to kind of let you know what you can expect in each setting, and also just like the general things that you can prepare for. Okay, so some of these things are going to be specific to having a vaginal birth, and I personally have not had a cesarean birth experience. I have friends and a sister that have, so I can kind of try my best to incorporate some of that as well. Some of these things will go hand in hand, whether it's a cesarean birth or a vaginal birth, but some of them will be more leaning to a vaginal birth, just because that's my own personal experience. Okay, so let's just say you're at your finish line, baby is born, everyone is safe, everyone is happy, you are kind of coming back into your body after having such a massive, profound experience. I want to let you know that whether you have a medicalized birth or a completely natural birth, it is not uncommon to need a beat to come back into your body, to realize what has just happened, realize that you've just given birth to your baby, and it is normal to not be ecstatic to see your baby right away. It's like you have just gone through such a massive, challenging, mentally and physically moment that it takes a second to register what just happened, register that there's now a baby on your chest, that you instantly have become a mother. And some women immediately bond with their babies, and others it takes a little bit more time. There are multiple factors of why this would occur. There are some theories, of course, with medicines that can interfere with the normal hormonal flow between you and your baby. Trauma can also impact the initial bonding to you and your baby. But once again, even if you had a completely natural birth, it is very normal to take some time to come back into yourself and then focus your attention on your baby. So I just want to preface by stating that, and that if you don't feel that immediate bond to your baby, that is normal. It will come, and it's going to be okay. It's going to be okay. That relationship and that bond, that very special mother-baby bond will build, whether it's instant or whether it takes a little bit more time. Okay, so after the baby is born, after the birth of the placenta, your care provider, doctor or midwife, is going to do a little bit of an exam to make sure, to just examine how things are looking. You may have experienced a tear, or maybe you didn't. They will rinse you off with a little bit of warm water so they can take a nice visual of your perineum and your tissues and see what's going on. So if in the case that you had some tearing, they will suture you up. There are multiple different types of tears: first degree, second degree, third and fourth. First and second degree are obviously preferred because the first degree is just the initial tissue. Second degree is going a little bit deeper into the muscle, but generally first and second degree tears are more straightforward as far as the repair and the suturing goes. So if you've had an epidural, they don't necessarily need to use local anesthesia because your lower half is already numb. If you've had unmedicated birth and you did not receive epidural anesthesia, they will use a local anesthetic such as a lidocaine to numb the tissue before they do the suturing. I will say I've had both experiences. I did tear with both of my births, nothing very severe. My first birth, I had a first degree tear. I received a couple stitches, and because I had that epidural, I did not need additional anesthesia, and that was really straightforward because truthfully I could not feel it at all. My second experience was an unmedicated birth. Because I didn't have an epidural, I did need to receive some local anesthesia, which in your lady parts, that is obviously not going to be comfortable, guys. Your tissues have really spread and opened to deliver and birth your baby. And though I didn't have severe tearing, everything was really, really sore and burny. And I remember when my midwife was kind of rinsing me off to assess what was going on, that burned like hell. So it's just something to be aware of. And, in the hospital setting, if you are having an unmedicated birth and they're just kind of going about the procedures as usual, they may not be as mindful to the fact that you are feeling everything. Whereas, many women in the hospital decide to get an epidural. Most of the time, if they're used to working on women with an epidural, they're not going to feel what they're doing. So it's just something to be aware of and talk to your care provider and let them know, like, ooh, I'm really feeling that. Ouch, that's sore. And they'll just kind of walk you through the procedure. It's not necessarily going to be pain-free because they are having to suture very delicate tissue. But if you are in pain, they need to know. If they need to pause and give you a little more local anesthesia, that's also something that might be necessary. I will say in my second birth experience, having my repairs done was definitely my least favorite part. Like I said, having the tissues rinsed off was really burny. It really hurt. And I did have a second degree tear in that birth. So it required a few more stitches than my initial birth, my first birth. And I remember just kind of gritting and bearing it. And I was holding my husband's hand. My daughter was on my chest, skin to skin. And I was trying to just breathe and be calm through that. And the repair itself didn't take very long, but it is just something to be aware of. Okay, so that's just the perineal and tearing that you can experience with birth. If you are very fortunate, you will not have any tearing at all, which definitely occurs, and God bless those women that don't have to experience the tearing. Okay, something that's also very common when pushing with a vaginal birth are hemorrhoids. Hemorrhoids are something that some women may experience throughout their birth or even with pregnancy, and hemorrhoids can be very uncomfortable. There are veins that are essentially kind of popping out and are around your anus, and obviously when you are pushing your baby down, there's a lot of pressure down through your lower half, and hence why the hemorrhoids can pop up. So we'll talk a little bit about what the process is with your care down there after the birth, but hemorrhoids is something that is very common and something to be aware of. Okay, so let's say the repairs are taken care of, and for example, you decided to have the epidural. Before they kind of let you fully go, they're gonna wait for your anesthesia to wear off, and then your nurse is going to be with you hand in hand, arm in arm, guiding you to the restroom to make sure that you're able to empty your bladder. In my second birth experience, this was no problem because I could get up right away. I didn't feel weak on my legs. I felt really stable for the most part. And my nurse escorted me to the restroom. You use the toilet. You're going to use something called a peri bottle, which you're going to kind of spray warm water on yourself as you're urinating, and that's going to help kind of rinse you and soothe the tissue while you're going to the restroom. But if you have had an epidural, they're going to make sure that you're not feeling the numbness anymore. They're going to help you, escort you to the toilet to use the bathroom. And this is really important because in some cases, women are having issues where they're not able to empty their bladder. And if that was the case, they would use a catheter to drain your bladder and make sure you then have an empty bladder. But they are going to want to make sure that you can use the restroom on your own. One of the factors in having a really full bladder after birth is that it could prevent your uterus from really clamping down. And if we don't have a uterus that's clamping down really well, you can have some excess bleeding or something called a postpartum hemorrhage. So having an empty bladder is really essential in making sure that that uterus can really get nice and firm and start to clamp down and start to shrink back down. So that is what's going to happen. And when you're using the toilet, it is a whole thing. Like I mentioned, you'll have a peri bottle. The hospital will give you one, or you can buy one on your own. I really like the Freedom Mom products. There are so many incredible products that they have. Not sponsored. I just use them for both my births. They have a peri bottle that helps kind of direct the water straight up at you. And like I said, you'll spray yourself off as you're urinating, and then you will have a whole process from there. You'll be experiencing some postpartum bleeding. Blood loss after birth is normal. Your body is increasing your blood volume while you're pregnant to prepare for the blood loss after birth. If you've experienced a postpartum hemorrhage, that is something different. That is when you've lost more blood than is expected, and there are different things to manage that. But I'm just referring to a normal blood loss that you're experiencing after delivery. So the blood loss after delivery is going to feel more like a heavy menstrual period. You may have some larger clots. If you have any concerns, of course, talk to your nurse or your care provider to assess, because they're going to want to know if you're passing really, really large clots, or if you're filling one of the really big pads within 15 minutes, 30 minutes. Those are things that you need to let your care provider know. But when you're using the restroom, you are going to have either a massive giant pad in mesh panties, or you might be in a full-on lady diaper. Doesn't matter. You will choose what you prefer. In the hospital, generally, they'll give you mesh panties and a massive pad that is like literally this long, that goes all the way to front to back. And so that is what you're going to use. It is important to note, once the bleeding has slowed down, we do not ever use tampons. We are using pads. We are bleeding into pads. Nothing should be going inside. So something that you can use, a lot of women are going to experience some swelling after their delivery. You can use something called Dermaplast, which is essentially an anesthetic spray that is an aerosol, and you spray on your vulva to help reduce that pain. And you're also going to probably use some witch hazel wipes or foam. Witch hazel is amazing for the soreness of your perineum, your vulva, and your booty, because if you have hemorrhoids, witch hazel is also amazing to help soothe that and help resolve those. So you'll become into a more of a routine each time you use the bathroom. You're gonna pee and spray. You're gonna probably spray yourself with some Dermaplast in the first few days. And you could either use a witch hazel foam or witch hazel little sheets that you can kind of lay over your pad, and you are then good to go. Also brings me into the next thing. Let's talk about your first postpartum poop. It is very, very normal for you to have some worry about your first postpartum poo. This is because whether it's cesarean or a vaginal birth, your system has kind of halted up during that labor and birth process, And many women can experience some level of constipation when they're first having their first bowel movement after birth. And so many times in the hospital setting, you will be given some sort of stool softener to help ease that first poo. If you've had a cesarean birth, because you've obviously been under a more intense regimen of medications and anesthetic and maybe painkillers, those are things that kind of can stop up your digestion system and cause that constipation. So my biggest suggestion is if you're having stool softeners, great. That's going to help ease the process of having your first poo. Being extremely, extremely hydrated is also going to help. Obviously, if we're really hydrated, there's going to be more water in the stool itself, which is going to be easier to pass. So just know that your first postpartum poo doesn't have to be scary or painful. It can be really okay. Many women, when they're in labor, have many frequent bowel movements, and that clears them out. So you may not necessarily be constipated at all. But just know it's going to be okay. It's going to get easier. Your perineum might be sore as you're using the bathroom because it has gone through a lot. But, no pun intended, but also pun intended, your bowel movements will get easier and you won't have that kind of fear surrounding it. So just relax. If you need to run some water, put your finger in warm water, hydrate, and it's going to be okay. Okay, so another thing after the potty stuff. Once again, your vulva might be very swollen. It depends on a lot of factors, how the pushing stage went, if you tore, if you had lots of sutures, that kind of thing. There are pad sickles available, which once again, Freedom Mom makes a good one. You can make your own homemade ones, where essentially it's this big giant pad that kind of cracks and turns into a nice ice pack. And you'll wear that in your diaper or your mesh panties. That's going to help soothe the tissue. There are different views on how long you should use ice after birth. Some say after 24 hours, no more ice packs. Others I don't think have much to say about it. But listen to your body. If you are not really having a lot of swelling anymore, then maybe stop using the ice packs. But definitely initially after birth, you will be given those ice packs to help soothe that tissue there. Okay, so those are the initial things for the lower half. If you're a breastfeeding mom, you are going to be making amazing liquid gold colostrum in your early days postpartum. Colostrum is your baby's first milk. It is going to be a thicker, golden, stickier milk that comes out of your breasts. It's not going to be white, flowing milk. It is, think of it as baby's first food, baby's first immunizations, baby's first everything. It is nature's design that is all your baby is receiving within those first few days of birth. So during this first 24-hour window, like we said, that is all your baby is going to be receiving. That amazing, amazing colostrum. Do not fear that your baby is not getting enough. Your baby's tiny tummy is like the teeniest little thing when they're first born. Think back to nature. Think back to how this was all designed. Your baby is meant to only receive that tiny amount of colostrum in those first few days of milk before your more mature milk comes in around day 3, 4. So that is something to be aware of, especially if you're a first-time mom breastfeeding for the very first time. I remember the feeling of I trust it, but also is my baby hungry? They're okay. Unless there is a medical concern, I want you to remind yourself that if you were making colostrum, which you will be, that is what your baby is intended to eat. Okay, no extra water. You don't need to supplement with formula. I am not your healthcare provider. This is personal experience, but nature's design, baby is receiving that colostrum in those first few days post-birth. Okay, so also with breastfeeding, you can expect that your nipples are probably going to be sore, probably going to be tender. In the hospital, most hospitals should have a lactation consultant come see you. That lactation consultant will check on baby. They'll kind of do an oral assessment to see if there are any lip or tongue ties. They are going to evaluate the latch and make sure things are looking good on the external, but also that they're feeling good for you. I encourage you to watch my breastfeeding videos. If you haven't, I go into all of this in a 2-part series. I break down everything breastfeeding that I have been through, what I have learned in my midwifery studies. So if you plan on breastfeeding, I highly, highly encourage you to watch those previous videos or do your own research in other regards. Okay, so once your baby is on the breast, you will likely have some soreness because whether this is your first time breastfeeding or your 5th time breastfeeding, there is a little bit of a learning where this is your new partner. We want to make sure that the latch is good, feeling good, but there is going to likely be some tenderness and some soreness in your nipples and your breasts. Your milk is going to come in after a few days postpartum, and that is when you're probably going to have some soreness and tenderness and potentially engorgement in your breast tissue because your milk is coming in full force. Okay, so that's the breast stuff. You can use some nice organic nipple balms. You can use a product called Silverettes. Those are these little silver cups that you wear in between your nursing bra and your nipples. If you use the Silverette product, you do not need additional balm. The silver itself is antimicrobial and soothing, and that is really all you need. So yes, that is the basics of the breastfeeding. And also, it's important to know that this first 24-hour, if you have baby on your chest the majority of the time, amazing. It is normal to have the baby at the breast as often as the baby wants. Cluster feeding is something that is very normal. That's when baby is on the boob, which seems like all the time. And cluster feeding is going to help establish that really robust milk supply. And also skin to skin in general is just so incredible for you and the baby. You're releasing that incredible love hormone oxytocin. Your skin is helping to regulate all of their systems. Respiration, their body temperature, literally everything. So whether you're in the shower and need a break, have your baby go to your husband or your partner, make sure that baby's skin to skin, put a blanket over top the baby to make sure the baby's nice and warm. But being skin to skin with a nice healthy adult is going to help regulate that baby's body temperature. So as cute as they are, all wrapped up like a little burrito, I encourage you to free them, to strip them down to their diaper and have that baby skin to skin. And like I said, have a nice blanket around the back of them. So skin to skin throughout postpartum is absolutely incredible, but especially during that first 24 hours, whether you're in the hospital or you had the home birth, baby on you is just amazing, amazing. Okay, so another thing I want to talk to you about is during this initial window, around that 24-hour period of time, or throughout that 24-hour period of time, if you're in the hospital, your nurses are going to come in periodically and want to feel on your fundus. So you may have heard of something called a fundal massage, and it's not really a massage, ladies. I hate to break it to you, but your nurses are going to press down on your abdomen and feel for your fundus, which is the top of your uterus. Why is this done? Well, your fundus is, like I said, the top of your uterus, and they're going to want to feel that it is nice and firm. We want to make sure that our uterus is clamping down and becoming nice and firm, because that is telling us that it's doing the right thing. It's doing what it's supposed to do, and it's kind of closing off those vessels that are on the inside of the uterus, and it's going to reduce any risk of postpartum hemorrhage. They're going to check and make sure that your fundus is feeling nice and firm. They don't want it to feel boggy where it's soft and not clamping down. That's an indication that your uterus is not doing what it needs to be doing. So they're going to massage your uterus every so often to feel and confirm that it is doing what it needs to be doing and that it's becoming nice and firm and starting to shrink back down. So in relation to the fundal massage, you will also notice when you're nursing your baby that you are experiencing afterbirth pains. So this is something a lot of women are not really aware of, or if it's their second, third, fourth baby, they don't realize how intense these afterbirth pains can be. So an afterbirth pain is essentially your uterus is starting to cramp because it's clamping back down and it's starting to shrink back down. Our babies and our bodies are amazing that when the baby's at the breast, your brain is releasing oxytocin. what's the key labor hormone? Oxytocin. So oxytocin, once again, is starting to kind of contract down at your uterus, and it's going to help shrink the uterus back down to size. So when the baby's at the breast, it is really normal to feel these like cramping sensations occur, and it can last a few days to a week or longer, depending. Breathe through it. It's hard. I remember my second baby, my afterbirth pains were definitely more intense than they were after my first daughter. And that's normal. Essentially, if you think about it, with second, third, fourth babies, your uterus has stretched out multiple times, and it grows, and then it shrinks back to size. So if this is your third baby and your afterbirth pains are really severe, it's because the uterus has stretched out to that amount multiple times, and it does have to do a little bit more intense work to shrink back down to size. So that is something that is important to know. Okay, so let's talk about a little bit about baby. Baby is going to probably be very sleepy after birth, which is really amazing. Keep in mind that your baby is an active participant in your labor and your birth. So not only are you exhausted, your baby is pretty tired too, because they had to do a lot of work and they did feel some stress of labor to be born. So it's really normal within that first 24-hour period that your baby's calm, they're sleepy. You know, they're an angel. Truly, they're angels delivered to us on this earth. Don't be surprised if night 2, baby comes into their body and they're realizing, I'm awake, this is a weird place, I don't know where I am. You know, the second night generally is pretty hard for new parents because it is more challenging than the first night. Okay, so within that 24-hour period, baby's sleeping a lot. They're freaking angels. I mean, newborn babies do sleep a lot. They're so stinking sweet. Love them. Okay, so they'll also be passing something called meconium, their first poop. So meconium is this tar-like blackish green first poo. It is surprising, I think, for new moms because they are like, whoa, what the heck is this stuff? So meconium is a bit sticky. You will be asked to kind of keep tabs on how many times your baby has either used or has urinated and or passed meconium. Within, I think it's 98% of newborn babies will have their first poop within the first 48 hours. If that's not happened, it's definitely something to talk to your pediatrician about. That we want to just know when all the tubes are working. So yeah, you will be asked to kind of pay attention to how often you have dirty diapers or pee diapers. So yes, meconium. It is sticky. As your milk comes in around day 3 or 4, the meconium will start to gradually change colors. It'll go from that really dark green to a light seedy green, and then eventually turn into a mustard color. So it's really important to know that your baby's poop is going to be like the rainbow. It's going to change and progress as the milk changes from colostrum into the more mature milk. Another thing, when babies are first born, they're going to have a yummy, maybe yummy is not the word for it. They're going to have a cheesy white vernix on them. If your baby is born early term, generally they will have more vernix. And as they are a little bit closer to 40 weeks and beyond, there may not be as much vernix. Vernix is the white, cheesy stuff that's on their skin. It's not something that should be wiped off. It literally is an incredible insulator. It's gonna help just be antimicrobial. So it should truly be rubbed into their skin like lotion. So that's also something fun. And you may notice that your baby has lots of little fur. So that's something called lanugo fur, little downy fur. My second baby had, really both of them actually, they had the fuzziest shoulders and fuzzy ears, and that lanugo will shed, but I think it's something that surprises a lot of first-time parents that they have these tiny little furry babies, but it's also so cute. So that's something I can think of that's a little surprising that maybe you didn't know. Another thing, it is very, very normal for your baby's privates, their genitalia, to be very inflamed. So little girls can have very inflamed vulvas. Little boys can have very inflamed scrotums, and this is all because of the hormones that you're experiencing that are passing to the baby. So that's something that can take parents by surprise, but once again, normal. And even babies can develop like breast tissue inflammation where they have little breast buds that are looking inflamed as well. Also normal. But in your unique situation, when your baby's born, if there are any concerns while you're in the hospital, of course, if your healthcare provider is not noticing them, bring it to their attention and just talk with them. I will say a massive pro to be in the hospital setting is that you have people looking after you, looking after your baby, and if any of these questions are coming up, that is the place. If you have a birth center birth or a home birth, you will also see your midwives. So for me, with my second birth, we left just a few hours after my daughter was born, but we returned back to the birth center less than 24 hours later, that following day. And that's when my baby had her hearing test, and we just kind of talked about everything, established that nursing was going well and all of that. So if you are having a hospital birth, your baby will also receive a hearing test and make sure that that's all good. It's important to note that it is very common that your baby does not pass the first time. Do not panic. Most of the time things are completely normal. In the situation for my first daughter, she was born at 37 weeks, and I had a very fast pushing phase, so she didn't get that squeeze, or as long of a squeeze. So the squeeze is when the baby's in the birth canal and amniotic fluid is coming out of their nose and mouth because they are being squeezed by the pressure. And this is a good thing because then it allows for easier breathing, and they're not going to have as much gunk and amniotic fluid in their lungs or their nose. And obviously ears are connected to all of that. So my first daughter, she did not pass the hearing test initially, but then she passed the second one. And that was because she had some residual fluid in her ear tubes. So that's just something to be aware of. I am not an expert in that stuff, but that is something that you can look forward to having done when your baby is in that 24-hour period. What else? There are so many things. This one's getting pretty long, so I'm probably going to cut it off now. But just know that whatever you're experiencing is probably pretty normal. Talk to your nurse, talk to your doctor, talk to your pediatrician, whatever issues or concerns are coming up for you, talk to them. And then listen to your intuition. If you feel like something's not quite right and they're telling you things are fine, you know, you might need to dig into certain things a little bit more, or vice versa, or they're telling you something might not be right and there needs to be additional testing on your newborn or something like that. Tune into your intuition. If you feel like things are fine, they probably are, and you might need a second opinion or something like that. I will go into more of that in a different video. So yeah, I'm going to leave it at that. I hope this was helpful. This is a very brief understanding of what the first 24 hours with the newborn is going to look like, with your healing process, what the baby is going to be doing. I hope this was helpful to you. So please make sure to share with a mom-to-be or a dad-to-be or a subsequent mom that is going to have her new baby soon. I hope this was helpful. I really do. I really do. Please make sure to like, share, and subscribe, and then you can head over to my Instagram. My handle is Birth in Bloom. I will put it right here. And I will see you in the next one, guys. Thank you so much for watching. Bye-bye.